Hello and welcome. It is the top of the hour, so we will go ahead and get started with our webinar. Thank you all for joining us. Today we will be talking about mental health and NF2 related schwannomatosis, which is a very important topic. Today is globally recognized NF2 Awareness Day, and May 22nd is chosen since NF2 is caused by an alteration to chromosome number 22. It also happens to be Mental Health Awareness Month, the month of May. So this is a very timely topic. We are so happy to have two expert speakers with us today, and thank you for sharing your time with us. I will introduce Dr. Louise Robinson and Louise Baker here in a minute. I'm Mary Sell. I am an NF2 Biosolutions, now known as Cure NF2 Foundation. I'm a board member and a parent of an NF2 patient. A couple of housekeeping notes. If you have questions, please type them in the Q&A box at any time during the webinar. We are going to answer questions at the end, so we'll save those up, but you can type them in at any time. Captions are available for this webinar, and on the Zoom Rooms controller, you'll want to tap on the captions icon. You may need to tap on the more icon first to see that. And as I mentioned, we do have a new name at NF2 Biosolutions. We are now known as Cure NF2 Foundation, and we have a new name and a renewed focus. This name better reflects who we are and what we do. After exploring many biological approaches, we decided to focus our efforts on gene therapy as the most promising path towards a cure. Our new name helps us clearly express our purpose and our renewed focus on moving research forward faster and making real progress for people living with NF2. So we are the same organization. We've just changed our name in the last month or so. Previously, NF2 Biosolutions. We're the same organization. We have the same goal. We are going to cure NF2. We are funding the same research projects. We have the same board of directors, the same scientists. Any money that was donated to NF2 Biosolutions moves forward with Cure NF2 Foundation. And as we mentioned, today is NF2 Awareness Day. We are always raising money, and today we're taking another important step forward. We wanted to update you on what we're currently working on. Behind every conversation, every appointment, every MRI, there are families facing NF2 every day. We know that. And they, families, you in the audience, me, we are counting on progress. We need a cure. So we want to continue to fundraise to get us there faster. Today, we're raising money to support the AAV9 NF2 gene therapy program and get that closer to patients in the trial. Before any new treatment can be tested in people, we must go through a critical preparation stage. This stage includes generating the data needed to show that this treatment is safe enough to begin human testing. We need to show that this treatment can be produced reliably and to the highest quality standards, and that the planned clinical trial is carefully designed, is ethical, and scientifically sound. So we're in the IND enabling study process. And this is a crucial bridge now between research and real treatments. So thank you so much. If you can support us in raising money for this step, you can donate at curenf2.org or using the QR code here if you are able. Every contribution is bringing us closer to a cure, and we've made so much progress. So thank you all who have contributed so far. Okay, I will go ahead and introduce our speakers now. We have Dr. Louise Robinson, who is a consultant clinical psychologist specializing in pediatric psychological care at Royal Manchester Children's Hospital, and it's pediatric psychosocial care at Royal Manchester Children's Hospital. She has extensive experience supporting children, young people, and families navigating complex medical conditions with a focus on mental health, resilience, and coping through treatment and uncertainty. I'll also introduce our second speaker who will follow. We have Louise Baker with us, and Louise Baker is an applied neuroscience specialist and founder of Applied Neuroscience Strategies with nearly a decade of experience translating neuroscience into practical tools for behavioral change and mental well-being. Her work focuses on helping individuals better understand and regulate their responses to stress through evidence-based, accessible techniques. So with that, I will go ahead and turn it over to our first speaker. And you can share your screen when you're ready there.
Okay, just one moment. Okay, has that come through?
I'm not seeing it yet. Oh, there it is. We got it.
Hi, so good afternoon for those of us in Europe and good morning for everyone over in America. So my name is Louise Robertson. I work in the NF2 service amongst other services in Manchester, and we are a lifespan service. So we cover pediatrics and
Please, Dr. Robinson.
So in today's presentation, it's going to be a bit of a whistle stop. I was asked to speak about the psychological impact of NF2.
I'm sorry, I was just going to mention your audio was breaking up a bit, and I wonder if turning off the camera might help the bandwidth speed. I don't know. We'll let you know.
Hopefully that will. Okay. So in today's presentation, it's going to be a bit of a whistle stop. I've been asked to talk about the psychological impact of NF2, and I'm also then planning on presenting part of a useful therapeutic framework within which to manage aspects of the psychological impact of NF2. And then at the end, to just add some brief thoughts on the transition to adulthood with NF2, as that's also seems to be really important. Now, within this talk, I am focusing on difficulties in the psychological impact. It's important to say that I don't think that poor mental health is in any way inevitable or present for everybody within an NF2 context. But I was hoping to think about where difficulties are present, how different strategies can be helpful.
Okay, I think we might have lost Dr. Robinson. Oh, your camera came back on and we lost you for a minute. Can you hear us?
I can hear you, but my presentation isn't moving on.
Okay. I might have yours as well. Let me see.
There we go.
You might stop sharing and reshare. There you go. Okay.
Sorry, this looks really poor. So when we're talking about the psychological impact of NF2, we might think about some of the following. So chronic stress around dealing with a very complex health problem that might need adaptations and involve disruption to day-to-day life, and then grief around these disruptions and the loss of what might be seen as a different normality, and possibly also loss of function. There might also be the presence of anxiety about progression of the disease. There might be disruption in identity for people, in both children and adults, and difficulty in placing NF2 within a person's identity and how to locate yourself in relation to that. There may be feelings of isolation and feeling different, especially within a paediatric context. Issues around loss of independence and having to ask for help, feelings of helplessness around the management of the condition and the ability to influence the condition itself. So to just take some of these things a little bit further, these living with NF2 often means coping with uncertainty about the future, loads of ongoing medical interventions and surveillance, symptoms which to the outside world may appear invisible but can have a profound impact on people themselves, feeling misunderstood, changes in work, in relationships, in identity, and again, that feeling different, and then fear of loss, the losses that might come along with the condition. So these can be experienced by the person with NF2, by parents of children with NF2, by partners and others in relation to themselves and each other. So fear about these things for family members, even for those who don't have the condition themselves. So common emotional responses to anything complex and potentially distressing like this might involve anxiety, depression, anger and frustration, avoidance of thinking about the condition, avoidance of aspects around the condition, feelings of hopelessness, and these are all really understandable human responses to difficult circumstances. So within clinical psychology, acceptance and commitment therapy, known as ACT, is part of what we can call a third wave cognitive therapy. And this basically means it's a therapy focused on thoughts, but in a different way to the sort of CBT that people may have heard before, where that largely seeks to target and identify and challenge negative thinking as a means of improving mood and well-being. I mean, that is a vast oversimplification, but for these purposes. The reason that ACT seems to fit so well in a health context is because it recognises that some of your thoughts might be realistic. It may well be that these difficult things are going on. It may well be that these struggles are very real. But we want to... So challenging them may be unsuccessful. So instead, ACT is a psychological approach based on accepting difficult thoughts and emotions and reducing that struggle with internal experiences, in connecting with personal values and what's important, and being able to take meaningful action despite the challenges that are very real. And the core aim of this around reducing that struggle is to increase psychological flexibility. So, which is the ability to sort of stay present in the moment, to open up to difficult experiences rather than trying to shut down or avoid or not think about them, and to act in line with your own personal values and in order to live a meaningful life alongside uncertainty and live with NF2. So acceptance does not mean giving up. It does not mean saying it's okay, I'm cool with this, I'm not bothered, it doesn't matter, because that would be unrealistic. So it actually means making space for emotional pain, fear and uncertainty instead of constantly fighting or suppressing them. Accepting uncertainty around scans and being able to manage grief around losses, and hearing loss might be one of those. Allowing fear, allowing yourself to feel scared and to acknowledge that, but without letting it dominate behaviour. So as part of this whole whistle-stop tour, I'd like to outline a few of the core psychological concepts which aim to increase psychological flexibility and reduce the stuckness that can come with emotional struggles. So the first of these strategies is called cognitive diffusion. So when you are struggling with negative thoughts, these might be in the context of anxiety, low mood, or the other emotional distress that we talked about before, thoughts can present themselves as fact. I am statements. I am anxious. I am struggling. Or I can't, and we can define ourselves through these statements. Cognitive diffusion is about unhooking or untangling ourselves from these thoughts that are pulling us around so that we can step back from them and either let them pass or work out how to respond to them and if they require an action. So some helpful techniques for this may include naming the thought. I am feeling anxious. I am having an anxious thought. Sometimes for some of the really tricky ones, it might be singing the thought or repeating the thoughts more slowly. The second strategy is around more present moment awareness, returning ourselves into the present. So this is particularly useful for anxious thoughts because so much of anxiety is about worries about what might happen in the future, but something that's not yet determined. So it can also help where we might be stuck ruminating on something that's happened in the past and feeling really unable to move on from that. And this is really important because it gets in the way of our living in the here and now and experiencing our lives around us, the people around us, and feeling connected. So we do need to return to the present. So as on the slide, the chronic illness can pull our attention away into fear about the future, regret about the past. Mindfulness can help us connect with the current moment, body sensations, our surroundings, meaningful experiences, so that we are living our life in the present rather than that foot in the past or the foot in the future. Some simple practices might involve grounding techniques, breathing exercises, mindful walking. Listening exercises can be really helpful in shifting our attention away from swirling thoughts and back into the here and now. And Louise Baker is going to present some excellent techniques that will also be helpful within this context. And these sorts of strategies are really important during peak times of anxiety, and that might be around things like being in an MR scanner, waiting in the waiting room for a medical appointment to get results, or during symptom flare-ups. So another strategy involves connection and identification of values. So values are ongoing directions. They are not goals to complete. So examples of values might be about connection with other people as a concept rather than connection with one person and feeling as though you're there and you've achieved it. Creativity might be an important value. Compassion and listening and care for others might be a value. Being independent, enjoying learning, family and family life as a value, or advocacy for others. So within a chronic illness context, some activities might change. It may be that this condition brings along new restrictions in what you can do, but if you can connect to a value, then you may be able to shift from one set of activities to another. And it may mean loss, but it may also mean that you still feel like you are being the person that you want to be. So, for example, for someone who values connection, that might mean a shift from going to big social events. But if hearing or confidence or pain or mobility means that some of those things aren't possible, that connection can be found in meaningful conversations with people and connecting with others in a different way. So valuing contribution might involve something that advocacy for others, involvement with charities and groups, or peer support. Okay. So the next strategy is around committed action, which is taking meaningful steps towards the future and the way of living that you want to have. So ACT encourages actions that are aligned with your values, even in the presence of pain or fear or limitations. So an example in NF2, in an illness context, might be attending support groups in order to get that connection, to feel able to support others and receive support yourself. It might mean asking for accommodations in a school or a work context or even a medical consultation. It might mean continuing in hobbies in an adapted way, maintaining relationships, pursuing education or work where possible, or advocating for accessibility. So it's finding those things that are important to us and finding a way of doing them that aligns with values. So psychological flexibility, as I mentioned earlier in NF2, the goal is not to feel better all of the time, because that might not be possible, but it's about being able to respond flexibly within situations and to challenges, to be able to stay connected to values and building a meaningful life alongside illness. So psychological flexibility can help with reduced avoidance, that cycle that can go on of trying not to think about it because thinking about it brings anxiety and emotional pain. It might mean better emotional coping and feeling like that emotional landscape is a little bit more stable. It might mean increased resilience, which resilience is often banded around as a term which makes us think of not being bothered. But resilience is about feeling the feelings and doing things anyway, being able to do things that are important to us. It might also mean an improved quality of life and a greater sense of meaning and agency of kind of the ability to advocate and for you and control for yourself. So everyday tools within this concept. Acceptance can allow emotions without immediate avoidance. Diffusion might involve noticing thoughts instead of obeying them or getting stuck in them. So I'm noticing that I'm having a thought of. Mindfulness can allow us to ground ourselves in the present moment and not feel pulled away in a tide of anxiety. For values, often identifying those in a tricky situation or just generally to ask yourself the question, what kind of person do I want to be in this situation? What value do I want to bring forward when I'm a bit stuck on what to do and something's a real challenge? And a practical act strategy around committed action might be about taking one small, meaningful step daily, particularly in a context where you're feeling quite stuck. So, key takeaways from that part of the presentation would be things that you already know. NF2 can affect both physical and emotional well-being. ACT as I've presented it, but there's obviously a much larger body of literature and different strategies. I've just done a snapshot, can help people relate differently to emotional pain and uncertainty. Acceptance is not surrender. Thoughts are not facts. Values can guide meaningful living, even in the context of difficulty or disability. A fulfilling life is still possible alongside chronic illness. So as my final slide, I was asked to talk a little bit about that transition from child to adult with NF2. And we talked about this a little bit in the context of the different perspectives around this. So the parent perspective of managing healthcare for your child and coordinating and being the spokesperson in that context, to the scary world that is often being told by medical services, particularly if you literally transition from one service to another, that actually you can no longer do that, and that primarily your child, who may now be an adult, is the person involved. And for this, I quite like the driving metaphor, that you start off where the parent is driving the child's healthcare and driving that car, whereas actually what we want to get towards is the slightly scarier concept in the bottom of the young person and then adult driving their own healthcare and their own life. Lots of ways. I just thought that it might useful to think about some top tips. As a lifespan service, this is actually less than in services where there is clearer demarcation between ages. But I think in order to have that successful transition, it's really important to get children involved.
I think we lost Dr. Robinson altogether now. We will see if she hops back on. I know she got through her slides there and it was a little bit choppy, but I learned so much. That was great. Next up, we will have Louise Baker. So if you want to get your slides up, we will transition and we'll see if Dr. Robinson comes back.
Hi, let's see. Let's get these. Guys, don't have many slides, so let's go for it, eh? Share, and here we go.
We can see them. Thank you.
Thank you. So, hello everyone. I'm Louise, and I'm so thrilled to be here and to talk to you all. And I would love everybody to just have a think about what we're going to talk about. So, I just wanted to follow on from the fantastic presentation by Dr. Louise, who talked about some amazing approaches and techniques there and explained that we are so aligned, it's unbelievable. And that idea that you could really, truly, take more control than you think you can and enjoy life a little more than perhaps you think you can is all a question of how we align those beliefs and those values and what's going on. So I'm going to talk a little bit and give you a small dose of neuroscience theory, but stick with me because I have with me a whole family of toys. Now, toys and how we play is a really important part of our creativity and our learning. And everything I'm going to say today is hopefully going to help make some dots join up for you and understand why some things might work and some things don't. And a lot of that has to do with your uniqueness and your background and all the things that surround you, your psychosocial setting. But other stuff has to do with it is that we sometimes just need to make a few touches, some few changes that will make things work out more nicely. So I'm going to ask you to be very curious. This is Ollie. Ollie the octopus I use in two ways. One of those ways is to help demonstrate how we build new beliefs, how we can change our values. And that's simply by practicing some ideas, practicing some thoughts, practicing ACT. And what that practice does, it just helps build these neural, they've got a little neuron there, these tentacles that make pathways to the one day you didn't think you could do something, but over time of practicing it, you realized you could. And the same stands for all of those things that Dr. Louise was talking about. I've worked within the brain tumor community for over 10 years now. And it's the reason I went off and did my postgraduate certificate in neuroanatomy, because I really wanted to understand what was being affected. So this small dose of neuroscience theory that we've already started on has been a little bit about something called neuroplasticity, how we make new pathways in our brain by practice, by repeating things, by being ever so curious, by just thinking, okay, I'll give it a go. Can you be a person who just gives it a go for a while? Because the second part of my presentation is going to be more practical. And I can't see anybody at the moment. And what I am going to do is I'm going to ask you to join in. Join in with a little bit of touch, breath work, focus, and attention and understand. So let me explain a little bit more of what's going on inside you. There we go. And we're going to talk a little bit about the rhythms of life. Okay, the rhythms of your thinking. So we spend a lot of our time with these waves running through our brain. And basically, when we are in a certain condition, we can take in much, much more information than when we're very busy and doing lots of stuff. And that busyness is created or by the chemistry inside our bodies. So I like to talk to people about the fact that we create a lot of brain chemistry, of course, in our heads themselves. So all of that stuff going on is often bouncing around and pushed through by a wonderful piece of chemistry called noradrenaline. Now, you all have heard of adrenaline. Adrenaline is to do with the fight-flight response. And the fight-flight response absolutely gets our bodies mobilized, but it really gets our heads mobilized a lot as well. And so the reason I like to talk about these oscillations that go on in our brain, these brain waves, is because we have control over our brain waves. So I know, and I don't know what the individual circumstances of everybody watching this webinar are. So I'm going to do lots of adaptations to this one. So the very first thing that we can do, and if you are watching the captions, you don't need to do this, but you can do it for a split second because I want to really hone this point. The very best thing we can do immediately to shift our brain is to say, for example, we're coming from this bright redness over here with the beta and gamma waves, is to close our eyes. And if we were to close our eyes, which everybody asks, lots of sessions involved in eye closure, that might seem a bit strange, but all we're doing is asking our brain to not have to process all the visual information. So I'd like you to think about it like that. If you are struggling with your hearing, of course, because I've been working with people who are profoundly deaf with these processes, then that's tricky because you can't hear a meditation or you can't listen to a tape. So stick with me on this one, because the first thing I'm going to do is ask you to do something called bilateral stimulation. Well, the very first thing I'm going to ask you to do is to breathe. Take a breath. Now, when you take a breath, it does many things. If you breathe down into your tummy, or you take a deeper breath as is comfortable for you, it signals a change. And we know that diaphragmatic breathing is very good for us. We take a breath in and we breathe into the tummy and we breathe out. But what I'm going to say to you might surprise you is just the decision to stop and take that breath is really, really important. Because within our beautiful brain stems, which I'm just going to demonstrate here, here's your brain stem. Here we go. Within this brain stem, and I'm going to come up to about this area just here, is an area of your brain that's got some very special nuclei in it, and they're responsible for your breathing. And this is why breathing exercises are so widely publicized, because breathing signifies to the brain that I'm making a change. Think about that. The brain then goes, oh, okay, you want to change, you want to do something different. So before your chemistry has altered and there's a bit of panic going on, you can go, right, okay, I've got this. I'm going to breathe. Breathe in and breathe out. And you know what? I don't get more complicated than that. Let me explain why. Because there's so much about breathing, and breathing exercises are so important, and you can learn very deep breathing, very good breathing exercises. What I say is just know that your breathing changes how you're feeling. Next to these areas of you've got mainly 3 breathing centers around this area of the brainstem, is another 2 little beautiful little nuclei. Oh, here I'm going to call them, I'm going to hold these up to show you, called the blue spots. And these blue spots are responsible for producing noradrenaline in your brain. So not only have we got eye closure, but we've got a breath, and we're now telling the brain to calm down. Now, calming down is not the be all and end all of everything, because we're always going to be producing adrenaline and getting busy and having something to think about. But what it does is it puts you back in the driving seat of how much you're producing of this stuff that's running around in your head. basically making everything very excited. So we have little blue spots, and we have breathing, and we have our body. So I'm going to ask if you're around a pen or a pencil, because this is a very easy one to do. This is the start of a lovely journey called bilateral stimulation. And all of these things kind of sweep beautifully and dovetail into what Dr. Louise was saying. They don't replace it. They make, when you do those classes or you do those therapies, so much more available, so much easier to learn. So here we go. From one side, well, I'm going to tell you a bit of a story about this first. From the moment you pick something up, and here, look, I've got a nice brain here, little plastic brain here. From the moment you pick this up, multiple signals are registering from your fingertips through your arm into your spinal cord and up. Now, if you don't have the capacity to pick up or do anything like that, I shall show you. Let me move Ollie off my lap. You're not going to be able to see me. Then you can place your hands wherever you can and just tap. So this is one of the movements that many people use, which is this, just a bilateral tap, very, very gently. And you can do those tappings anywhere on your knees. You can gently lift your feet and let one down again, moving, moving gently and slowly. And you might be really curious as to why I'm saying slowly, because there's beautiful research out there that shows when we are touched, and when we touch, I'm doing another thing now, just with your hands. And you could, if you, I'm just going to move my camera slightly so you might see my hands. So I'm going to support my elbows, support them on a cushion if it's uncomfortable, or anyway, or just rub your hands very gently together. No faster than this. Now, I'm just going to go back a step, because what we've done is we've taken a breath and we've breathed out. We've signaled there's a change coming. We've picked something up and we've noticed. And now we're going to move it to the center and across, because now we're stimulating both sides of the brain. And what that allows is us to start to bring our thinking brain back into focus, because it's not rushing around on anything anymore. I do hope some of you are joining in on this, just making sure I can hold it in a place you can see. Now, this bilateral stimulation you can do with anything. You could do it with a teddy bear. You could do it with a soft toy with your child. You could do it any way you like. If you're having a difficult meeting, if you're on a phone, if the bureaucracy is getting to you, just breathe and bilaterally stimulate. And remind yourself of all the work you've done in your therapy, or what's really important to you. What's really important to you right now is that I get the result I wanted to, which was the appointment confirmed, or that I'm able to stay comfortable in the scanner, or that at this moment in time, I'm just going to change the way I'm thinking about that thing. Believe you can change the way you're thinking about something. Remember, be curious, allow the neuroplasticity to join up. And I've got another toy over here. This is my jellyfish, because I refer to, when I'm working with my clients, my clients are mainly adults, but you know what? All adults have children inside, and it's nice to think that you've got solutions to all of the stingers, the different stingers that are going to come at you. So that's why I use my jellyfish. So we have bilateral stimulation, and I know I'm making these things seem very light, and that's for a reason, because if they feel light, you may pull them into your very being much more easily. Now, the next one, we already started on this. I'm going to start on this. And I'm going to recommend you doing the tapping or the stroking with your hands, because in a minute we're going to change from our touch and our breath. As what's happening here, as you can see, is as these brainwave patterns change, it means that our brain is able to move. You know what a murmuration of birds looks like? I like to think of it like that. So the murmuration, your focus changes from that massive, all smudged together focus down to the thing you want to focus on. Or you can use it to move from a thing you're focusing on with ultra focus up to something and over to something you'd rather focus on. So using these techniques through practice allows you to move between those thinking places that you've been spending your time and what you've been counseled in or what you've been talking to somebody else with. Next, we have a lovely hug. Now, this comes from a family of practices called psychosensory therapy. And I combine the work of the psychosensory therapy with some fantastic science, which showed that ultra slow touch registers safety. Ultra slow touch registers, I'm okay. Imagine that focus of the murmuration moving from one place to another place and allowing you to make decisions about what you want to do as opposed to what you don't want to do. Lovely, lovely techniques. And then the final one is just touching around the face. And what I say to people is we never go straight to the face because the face has so many receptors in it that it can be like, oh, a bit overwhelming. But of course, when we're overwhelmed, what do? Nature gave us a chemistry set to move between one technique and another technique. So I hope that you have been joining in and been doing this, because what I'm going to invite everybody to do now is, as per my earlier slide, is just think about what we've been doing. And I'm going to show a little, I don't know, no, I can't show that without stopping sharing. And I'm going to talk about rise, relax, imagine, suggest, empower, a way that you can ritualize the touch, the breath, moving yourself to a place where you can imagine. For those of you that are of sound hearing, I would invite you, if you wanted to participate, because we're just going to go on a lovely imagined mindful walk. How about that? So as you take a deep breath, and for those that want to, if you want to engage, allow your eyes to close. Please just continue to breathe very, very gently. And what we're doing is we're stepped down through the presentation. We've stepped down from a busy state to a much calmer state, where we may be able to practice something like a focus on our breathing. Just notice you're breathing in and out, and in and out. And I often invite people, because most people have a colour that they love, or a colour that they love that really helps them settle down. I love those blues and those, as you can see, aqua type colours. You might like something more vibrant. But just imagine. And when I say imagine, I say imagine. I don't say visualize, because your imagination and visualization are very different things. And this is a very important point for those who've tried to access meditations or anything of the type. Don't forget about it. Your brain knows what a beautiful ocean looks like, doesn't it? Your brain knows what stroking your pet feels like. You don't have to see it in your mind's eye to be able to utilize it. So I would invite you now to allow yourself to imagine that beautiful color of relaxation is just going to flow down you in this moment right now, to allow you to tune in and just enjoy the time, moment by moment and bit by bit, feeling yourself stepping down into a place of deeper relaxation. And the beautiful part about being in a relaxed space, in a grounded space, in a place in nature, is that then it's great to suggest an alternative. Suggest that you're feeling okay. Suggest to yourself that, do you know what, I can do this. And many of the people I work with like the idea of, if when we're working with adults, is that you've got your own back, that you are all right. Another way of looking at the concept of resilience, bringing it into a way you would speak with yourself. Now, I'm continuing, for those that you have your eyes closed, to just gently move my hands together. And you can do that too. And for those that are hard of hearing or aren't hearing at all, I would welcome you to just re-engage in this work too. And notice how everything settles down. Now, there's a wonderful neuroscientist called Lisa Feldman-Barrett who talks a lot about putting things in the battery of our existence. The brain uses over 20% of our fuel on a daily basis. And so just make sure it gets a break. So doing this for 5 or 10 minutes a day, this idea that you just move into a place of comfortable relaxation and soak yourself in your favorite color of relaxation. One doesn't need to lie on a bed. You can do it sat up in a chair. The most important thing is giving the mind some space to reclaim your own power, your resilience, and decide what it is that you want to do next. Giving you and putting back the empowerment. That's the structure of the RISE framework. So I would love to have spent so much more time with you all doing this work and doing long little mini meditation. But I really do hope that you have enjoyed this time that we've spent together. And that if you just pick up one thing, that will be fantastic. So just bring yourselves back. I hope we didn't lose the audience in that little relaxing spell. And really that brings, I think that's where we are.
Absolutely amazing to both of our speakers. I've learned so much that I'm going to apply immediately. I cannot wait to, look at this acceptance commitment therapy and try those steps and use some of these techniques and strategies. I personally thank you both for all the great information you've shared. We have some great comments and questions from our audience, so we will take a few minutes to go through those as well if you have a little more time. I wanted to share a comment. After Dr. Robinson was speaking, we had an audience member say, "This is extremely helpful information. Thank you. I'm going to seek out further information. And thank you for this information." So our audience is grateful. Some questions have come in, and either of you can jump in and answer. I think Dr. Robinson continues to have audio problem because I see her joining and leaving, but we'll see if she's able to join us again. So our first question is from Keith. I go to a I go to a specialized hospital and clinic medical center for my NF2 checkups, and I was wondering if an actual NF2 clinic would be more beneficial to help with all phases of NF2. I don't know, Miss Baker, if you feel anything there that you can touch on, if going to an NF2 clinic would be more beneficial, a more specialized clinic.
Of where you have people who have very focused knowledge, of course,
Yeah.
but a lot of thinking now is about what's the actual presentation that's causing you a problem. So I'm going to talk from a psychological and a neuroscience perspective, looking across the evidence base there. And there's more and more looking at, well, I really understand that thing that you're experiencing now, and it may be a very similar to something other people experience in other conditions as well. Therefore, the most important thing is that the individuals who are focused on your attention and your care are doing exactly that. I don't know how practical it is to be able to create NF2 clinics everywhere. I don't know. I haven't got an answer for that. It's not really my area of expertise, but I really do think that the way a lot of medicine is going to personalization is that there are people who are very good at being able to help you at the point of your requirement.
And I will comment that somebody with the Cure NF2 organization, we can reach out to you by email and share a little bit more information about specialized NF2 clinics.
Yeah,
we'll find
absolutely.
out your
I,
geography.
I think what I'm saying is the mind is very good at tricking us, and therefore it's really important to know that individuals who present themselves to support you really are trying to do that. And there isn't enough resource in the world, and to not let it become a focus, individuals are going to be very good at supporting you.
Okay, we have another question from a good friend of mine in the NF2 community. This is focused on neurodivergence. And he says, I have a question. How would you tailor or adapt psychological approaches for either NF2 fighters or their immediate support network, which would be parents, partners, siblings, close friends, if they're neurodivergent, either the patient or the support network is neurodivergent? Will this change substantially for those who are autistic, have ADHD or ODD, HD? How could this change when it comes to long-term fears, grief, and counseling?
Okay, I can't answer the long-term question. I can answer the question within looking at the techniques I've been looking at. So there are some neurodivergence conditions that really don't respond well to the sensory stimulation. So it's going to be well, let's experiment and see where the tolerances are, or whether actually we can grow the tolerances there. I think it's a great question, and because neurodivergence, as we've already read some of those categories, all are deserved of a look into each category and each response. I'm not going to stab at trying to answer that, because I don't even know that the research on neurodivergence and long-term conditions and in NF2 exists, if I'm really honest. I don't know if that research. Louise really would be a much better person. Sorry, I can't answer that very well.
That's helpful. Another great question from the audience. This is one I think about too. What would your advice be to those who have a rather militaristic view when it comes to NF2? They perceive it as a long war against the tumors it causes and those in the fight.
Okay, I do have a way of answering this, and it might not suit everybody. So I'll warn you. Here, this is groundbreaking. This is old. This is very established psychology, and I'm just going to do this. I'm going to draw a cat, a very quick cat, and a mouse. Right. Whenever a cat sees a mouse, okay, whenever a mouse, oh, no, wrong way. Whenever a mouse sees a cat, it has a response. Whenever we have an experience, we have a response. That response is going to be connected to our fight or flight system, connected to the constructs of our neurotransmitters and our chemistry. When we use words like battle and fight, they make my heart rate run. So my answer to this is really think about the language on a daily basis that is being used to describe the journey. Because if I were to tell myself, and you'll tell yourself you're in a daily battle, your body may respond like it's in a daily battle with all of the associated fight and flight chemistry that you may not actually want. So if I've understood the question correctly, it is about I would argue with acceptance therapy and great counseling and great work. It's about not being, what's the word, complicit in a collapse, but finding the language that works for you, that is focused on what you want to be doing with time that's practical and in front of you, as opposed to the focus on the battle of the next scan or the next procedure or the issue here or the issue there. The language really matters. It impacts our psyches and it impacts the psyches of everyone around us.
I think that is so helpful personally as a parent and caregiver. I mean, I know I've personally called it my warrior fighting NF2, and I haven't thought about how that impacts that person's.
I think if we, I mean, this is a really great thing to think about.
Mm-hmm.
A softer thing, and I don't want to get, I'm not going to drag us down into iconism or anything like that, but think about a rescuing icon that's not in a war.
Mm-hmm.
Maybe a Coast Guard or somebody who does something wonderful, or a wonderful naturalistic metaphor that shifts away from fight.
Yeah, thank you. Very helpful. Okay, this is along similar lines. Another question. My son tells me he has PTSD when he has to put on a face mask to undergo anesthesia. What are some simple coping mechanisms to deal with the PTSD right there in the moment, like going into surgery?
Before he's going in to have a mask on for some treatment. In the moment, the preparation for this starts way before. It starts with the breath work. It starts with working out what's the distance between having the scan and when do I first start to feel this. So the PTS is, let's think about the language here. What's happening is that the resilience is collapsing and there's no coping skills and he can't, everything comes over him. And I don't know if he's got whether he has claustrophobic tendencies or not, but how often this has happened can repeat the problem. So a lot of things is to think about moving the body to a point where you are calm, very, very gently calm, doing the breathing exercises, and then maybe introducing the idea that the procedure is in 2 weeks' time. oh, it feels okay still. And then bring it back, bring it back, bring it back to the moment so you get closer and closer. It really is a thing to work with a therapist on that can be really, really profoundly helped. But remember what I said about the building up the neuroplasticity as she hugs her toys because she's feeling a little bit herself. So is the idea is the practice has to happen before the events, and the belief that actually I can change this has got to go along the timeline. So moving from one position to another in time is in your imagination, like remember the RISE framework, practice the relaxation, imagining suggesting I'm going to be okay and I'm going to have this sussed. Now these are self-help tools. If it's very severe and you're and this son is really struggling, it's really worth talking to a therapist, a clinical psychologist about getting a very specific set of techniques that helps. What I've said works with many of the people. I work with people all the time with brain tumors. These situations come up all the time. There are techniques to move you around through time so you can take that feeling of relaxation that you've been experiencing and put it right in there with you. Or you can go into the scanner, or you can go into the radiation therapy and take yourself into a lovely place that you like to go with and stay still for 20 minutes and not, or 45 minutes. In fact, I've had clients in the world I work with brain tumors who wear the same masks for the same for similar treatments. They've been woken up. They've been pushed to come back to because the staff were worried and they go, no, 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 I was on my favorite place or my desert island. Or I was practicing, the funny one is I was practicing my stroking stuff. And I went, oh no, don't do that in a scanner. Or when you're doing something, they need you still. No, in my imagination, the client said. So what we can construct in our imaginations, and I'm going to make this really, really important point, is your brain can't deliver back to you how you want to be if it doesn't know how you want to be. Right, let that land. If you tell your brain, well, I can't do that, I can't do that, I can't overcome this, I can't be like this, then it's going to believe you and it's going to run on habit. So part of the building new pathways and this work is about the painstaking work of practicing how you really want to be. I'm not being Pollyanna, folks, because I really do know that this can help.
Absolutely. Wonderful.
I
And
hope
we're
that helped. So
yeah,
there isn't a one-stop answer. It is a program of practice and belief and changing belief.
yes, we have a few more comments here. Wow, this is insightful. And the hero, not the fighter. I love that. So,
I like that. Hero. Yeah,
hero. Yeah.
nice. I couldn't find the words at that moment. Yeah.
So we are back past the top of the hour again. That went really fast. That was such helpful information. I found lots of nuggets that I'm personally going to start applying. So I personally thank you, and I know our audience did too.
You're
So
welcome.
thank you all for joining us. I wish we could keep going. And do either of our speakers have any closing comments?
I practice
Yeah.
practice these techniques, find what works for you, work within a lovely framework like ACT, and practice what you supplement it with. It's absolutely life-changing.
Okay, everybody, thank you so much for your time today. And we'll let you all go.